Premier Scott Moe says Saskatchewan is experiencing a high rate of Omicron transmission, but so far that hasn't translated into a sharp increase in hospitalizations seen in other parts of the country.
Since December 21st, Canada is up with their hospitalization by some 377%. Saskatchewan's number is 23. When it comes to the ICUs, Canada is up about 107%. Saskatchewan's ICU numbers actually are down 65%.
Moe says other provinces had high Delta variant infections followed by hospitalizations, coupled with fast rising Omicron numbers. He says Saskatchewan's Omicron cases began when Delta cases were low. Moe says that is one of the reasons why the province will not be introducing measures like gathering limits. He says he is not convinced those measures are having an impact elsewhere and expects people to use their best judgment rather than be subjected to a health order.
I don't know that those are working in any other province across Canada. We're seeing numbers continue to spread in areas that have restrictions in place that go far beyond gathering limits, and the numbers of the Omicron spread seem to continue.
Saskatchewan's Chief Medical Health Officer, Dr. Shahab, says people should try not to have non-essential gatherings for 2 to 4 weeks. He says right now, 1 out of every 100 people may have Omicron. He says he expects that number to increase to 1 out of every 25 in a couple of weeks.
We'll probably see more households with Omicron than we've seen households with a COVID case in all the 4 waves before. And we all need to have a plan that if, one person gets Omicron, what's the plan? How will that person isolate?
Shahab says Saskatchewan is about 2 to 4 weeks behind Ontario. And he says that officials here will be watching both Saskatchewan and other provinces' hospitalization and ICU numbers to see when the Omicron wave has crested. Adam Hunter, CBC News, Regina.